everyone, this is Abby Caldwell. I am doing my presentation on Computer Assisted Instruction, or CAI, for Nursing Class 322, Teaching and Learning. So before we get started, I thought I would just give you a few of the names that CAI is also known as. So the textbook talks about three: CAI, Computer Assisted Instruction; CBO, Computer-Based Learning; and CBT, Computer-Based Training. So they all mean the same thing and can all refer to CAI. So, what is CAI? According to the International Journal of Education and Development, CAI is an instructional method that can be used online or offline and can enhance the learning process. It's a relatively new teaching method to the teaching world, but it's becoming more and more popular. I know I've had it in a couple of classes already. CAI uses a computer and a computer program to teach the student or the patient, and it also is offered in many different types of multimedia. Some major points about CAI are that it can be used to tutor a student or a patient, or it can be used as a teaching aid. It's accessible at any time, and it also is learner-focused teaching. So the domain of learning for CAI is the cognitive domain, or the thinking domain. It addresses the development of the learner's abilities. So the learner would be working their way up Bloom's taxonomy of learning. I have that picture provided here. So for example, if the learner was to take a quiz online, they would need to remember the information they were taught and then have enough of an understanding to answer the questions of the quiz. And for them to continue up the hierarchy, an example would be if they were participating in virtual simulation, they would be applying their knowledge to the simulation and then analyzing how the information they learned relates to the virtual simulation, and it just continues up the hierarchy. So some pros of CAI are that its instruction can be individualized to the learner. So if you have a patient that has heart disease and they know nothing about it, you can create a CAI or give them information about a CAI that can teach them all about heart disease. So it's really centered around the learner's needs and what the learner needs to know. A second pro is that it's readily available. So as long as the learner would have access to the computer, the information and teaching can be accessed 24/7. This is really beneficial to patients and students as well, so that they might not have time to call the doctor. It might be the middle of the night and they'd be able to look up information online and get reliable information. And it's available 24/7, so they can fit it into their schedule whenever it's needed. A third pro of CAI is that the learner can control the pace. So because of it being readily available, the learner can control the pace at which they go through the information. So for example, if one learner doesn't understand a topic or needs more explanation, they can spend more time on that topic to really understand and know it. Vice versa, if another student already understands that topic, they can just skim over the information or review it and move on to the next topic. So this is different from a traditional learning setting where the teacher has a pretty set pace of how they go through the information, and if a student would need extra time to learn information, they would have to set up a time outside of class, whereas with CAI, it's all about how fast they need to know the information. Another pro of CAI is the instructor can track the level of understanding. So most programs allow the instructor to track the learner's understanding. From personal experience with CAIs that I've had, when you go through the module or go through the information, there's usually little mini quizzes or a knowledge check here and there that just asks you a question, and based on your answer, it can provide feedback to the instructor so the instructor can know what your knowledge level is and what your understanding of the information is. And a final pro of CAI is that it provides immediate feedback to the learner. So this is also different from a traditional learning setting where you would learn the information, you would take a quiz, and then you'd have to wait for your instructor to provide you with feedback or to provide you with the quiz, and then you would look at it to see where you need more understanding, anything like that. With CAI, it provides immediate feedback. So if you take a quiz, you'll get the answers at the end of the quiz, so you can know what your understanding level is and know what areas you need to spend more time on. So the next topic is cons of CAI. The first one being that computer-assisted instruction programs are very complex. So for the instructor to make their own, it's almost nearly impossible. So they would have to find a program that fits what they need to teach the learner. So that leads me into my second con of cost of hardware and software required. So for learners who don't have computers or don't have access to computers, this can create a big issue because the cost of computers is pretty expensive, and as well as the cost of software. Some of these programs can go for, at the cheapest, $100, so that could be very detrimental to the learner and make it infeasible for them to use a CAI. A third con of CAI is lack of knowledge using the computer or the program. So if your learner is not technologically advanced and they don't know how to use a computer, or they don't understand how to use the program, or the program's confusing, this can make it very difficult and create a lot of stress and frustration, so the learner wouldn't benefit from this type of teaching. And a final con is that lack of personal one-on-one interaction. So for computer-assisted instruction, it is the learner and the computer. There's not that extra person there like your instructor. So if you have a question while you're going through the information, there's not really anyone there to answer it. You would have to find the answer for yourself. So this type of learning would not be beneficial for learners who have a low knowledge base or those who are poorly motivated. So this leads me into types of CAIs used in healthcare. The textbook talked about a few, and I'll go over them. So the first one is Milner Fenwick. It's a website that's available on the internet. This website is known for video use. It provides a lot of different videos on different topics. It's offered in a variety of languages, which is beneficial to patients who don't understand English or if they speak a different language. And it also covers a variety of topics, so that as well is beneficial, and it does come with free previews to the information. The second CAI used in healthcare is Pritchett Hull. It's known for reading material. They have extensive graphics with a lower reading level, and it also covers many topics. So as you can see in the picture, there's readings about chronic lung disease or heart failure or a good night's sleep, and that can be really beneficial to a patient if they really want to understand more about their disease or illness. Unfortunately, this one does cost a little bit of money, but it's not that expensive. So patients could opt to buy these readings. A third type of CAI used in healthcare is Medline Plus, which a lot of us might be familiar with. This tool offers interactive tutorials. It's offered to anyone who has access to a computer. All of these CAIs are. It covers a variety of information, and it's offered in different languages. So as you can see in the photo, it talks about health topics, medications and supplements. It also shows you videos and tools, which is another added benefit. It can tell you what your lab tests mean. There's a medical encyclopedia, so if your patient wouldn't understand information, they would be able to look it up here. So this is a really beneficial tool to patients as well as students who are trying to learn information. And the final CAI used in healthcare is virtual simulation. This is more for the student rather than a patient, but it provides the learner with an interactive program. It's accessible from any computer at any time, and it allows the patient or student with clinical experience without actually being in the hospital. So this is really beneficial to students because sometimes we don't always get all of those different clinical experiences. So virtual simulation can cover things from the ICU to the ER, to trauma, to med-surg floors. So it provides you with a lot of those different interactions we might not normally have. As you can see in the picture, it talks about safety measures, communication, assessments, interventions, medications, and testing diagnostics. So it's really like you're in the clinical setting. And then at the end of the simulation, it will go over things that you did well and areas that you can improve on. to benefit your learning. So all of these CAIs are available at any time and are available with the use of any computer. And that's everything that I have for you today about CAIs. Thank you.